If you or someone you love has just been told you need radiation therapy, I know that the feeling that comes next is almost always fear. And you know what? That fear is completely real, it's valid, and it has roots in decades of old stories. So in this explainer, we're going to take those old stories and replace them with new, solid evidence. We're going to turn that fear into confidence. Let's get started. So let's start with the facts. A really important study found that a staggering 94% of patients, that's almost everyone, said they were afraid before their first radiation treatment. So if you're feeling anxious, please know this: you are not alone. In fact, what you're feeling is the norm, not the exception. All right, in this first part, we're going to face these fears head on. What are they? Where are they even coming from? And why do they stick around? Because understanding where the fear starts is really the first step to taking it apart with the facts. When you look at the research, a pretty clear pattern shows up. The biggest worries are things like, will this damage my healthy organs? Or am I going to get skin burns? There's also that really deep fear about becoming radioactive. And then there's the simple but really powerful anxiety of just not knowing what's going to happen. And of course, the fear of pain. I'm guessing some of these sound pretty familiar. So where does all this come from? Well, evidence shows that for almost half of patients, 47% to be precise, it starts with what they call frightening stories. You hear them from friends, maybe family, or you read them online. And this builds up a whole narrative of fear before you even get to sit down and talk with your doctor for the first time. And that really gets to the heart of the problem. Radiotherapy has an outdated reputation that's based on the past. So, to really understand how precise and safe today's treatments are, we first have to look at the history that created that old reputation in the first place. I love this slide because it's the perfect way to explain the huge jump in technology. The old way of doing radiotherapy was kind of like a floodlight, a big, wide, unfocused beam. It hit the cancer, sure, but it also exposed a lot of healthy tissue around it. Modern radiotherapy, it's like a laser beam. Incredibly precise, designed to target only the cancer cells. And this is the most important thing to get. Those scary stories that are still floating around, almost all of them come from that floodlight era. They're based on the very real experiences of patients who were treated with older, much less precise technology. So the fear is based on a reality that, for most people today, just doesn't exist anymore. Okay, so let's leave the past behind and talk about right now. We're going to dive into these laser beam technologies that make today's radiotherapy so smart and see how they've totally changed the game when it comes to patient safety and getting the best results. So one of the main tools we have today is a technology called IMRT. Now, instead of one or two simple beams, IMRT uses powerful computers to control thousands of tiny little beamlets, all with different strengths. This lets your doctor basically sculpt or paint the radiation dose to fit the exact 3D shape of your tumor, no matter how weird or complicated that shape is. The goal here is pretty simple, but it's also revolutionary. It's to hit the cancer with a maximum powerful curative dose right where it needs to be, inside the tumor, while giving the absolute minimal, safest dose possible to the healthy organs and tissues that are just millimeters away. It's all about boosting the cure while dropping the side effects. And this isn't just a nice idea, it's proven. Look at the data from a big clinical trial called PARSER, which looked at cervical cancer. With modern IMRT, severe gut-related side effects were literally cut in half. They went from 38% down to 19%. And the risk of a really serious problem, like a bowel obstruction, it plummeted from 7% all the way down to just 1%. That's the real-world difference that precision makes. The technology is obviously impressive, but what really matters is the patient experience. So now let's look at the gap between what patients are afraid is going to happen and what they actually say it was like after they've finished. Right, so we know that 94% of people are scared going in, but what about on the other side? What's the feeling once you've actually been through it and you know what the experience is really like? And the answer is pretty incredible. While 94% were scared beforehand, surveys taken after treatment show that a huge majority, 83% of patients, said the experience was less scary than they thought it would be. There is a massive, proven gap between the fear and the reality. This quote from a survey of women who went through treatment for breast cancer, well, it just says it all. The overwhelming feeling from people who have actually walked this path is that the real truth of modern radiation therapy is much, much gentler than its old reputation. Okay, let's just bust some of the biggest myths, one by one. First up, the big one, the one that causes so much stress. This idea that you'll become radioactive and be a danger to your family. The answer is a clear, absolute no. With the kind of radiation we're talking about, external beam, the radiation passes through your body, and it's gone, instantly. It does not stay behind. You are not radioactive. You can go home and safely hug your kids, your partner, your grandkids, right after every single treatment. No waiting, no exceptions. Okay, next up, the treatment itself. When that machine turns on, are you gonna feel anything? Is it gonna hurt? And again, it's a simple and reassuring no. The radiation beams are totally silent, they're invisible, and they are painless. You can't see them, you can't hear them, and you absolutely cannot feel them. The experience is exactly like getting a normal X-ray or a CT scan. You feel nothing at all. So, knowing all of this, how can you actually take control and turn this information into real power for yourself? This last section is all about your path forward and how you can be an active partner in your own care. The research on this is crystal clear. The single biggest thing that helps reduce anxiety is building a strong, trusting relationship with your healthcare team. Communication is absolutely everything. When you feel heard, understood, and supported, it just makes a world of difference. So how do you actually build that partnership? Well, first, go into your appointments prepared. Seriously, write down every single thing you're afraid of or have a question about. Ask them straight up, what specific technology are you using for me? Talk about how you're going to manage any side effects before they even start. And finally, make sure you know exactly who to call, day or night, if you have a problem. Here are some fantastic questions to help you get that conversation started. Don't ever feel shy about asking for details. Ask about the technology by name. Ask how they're protecting you. Ask what you can do to help yourself feel better. And this is a great one. Ask if there's someone on the team, like a medical physicist, who can explain the safety checks. This is your care, and you have every right to understand it inside and out. Look, the gap between the old fear of radiotherapy and the modern reality is huge, and it's measurable. With amazing technologies like IMRT now widely available all across India, you have the right to a treatment that is precise, safe, and effective. We really hope this explainer helps you ask the right questions and move forward with a lot more confidence. The old stories do not have to be your story. This has been an educational presentation by the Radiotherapy India Project. Please always talk to your own radiation oncologist for medical advice that's personalized for you.